Just to summarise, when you're starting off, you have a look at the leg length. Now, when you're doing that, push the legs up towards the head so that you take out any slack. And then observe the legs before you extend them. And then bring the legs up and see what's happening. Now, there are a few possibilities. The short left leg may go shorter, the short left leg may go longer, or it may stay the same. It doesn't matter really. There are other distinctions that we can go into in later versions of this teaching. But the main thing to remember now is, if there's a short left leg, you're going to be dealing with the sacroiliac joint on the left hand side. If it's short on the right hand side, you're going to need to facilitate the sacroiliac on the right hand side. To treat the psoas muscle, you need to bend the person's leg like this, across your own knee. Now that exposes the muscle in the abdomen. Again, you find the top of the iliac crest, and if you roll over the top and inwards, you can compress the psoas more or less between your fingers and the hip bone here. Now at this point, you get the patient to straighten out the leg. So straighten up your leg, keep it up in the air now of your own accord, keep it up. Okay, now very, very slowly let it down, very, very slow. Do you feel it being pressed? Is it sensitive? Mm-hmm. Okay. Right, now that's the first round of that. Now you'll usually have to do 2 or 3 rounds of that to sort it out, but essentially what you're doing is you're massaging the muscle. You're homing in on the psoas muscle. You'll feel it under your fingers. The person will feel it a little bit painful. So you let their leg down slowly in a controlled manner. And when you do that 2 or 3 times, you can check the arms again. So we'll raise the leg, put it across my knee there. Okay, now again, just to find it, you bring the 2 hands like that over this way, and in that position with the leg raised, you'll feel it like a little bump in there. Now straighten out your leg. Okay, keep the leg up straight. Very, very slowly now let it down. Slowly, slowly, slowly. Slowly, 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 slowly. Okay. Now you can also do a movement like this, where you bring up the leg, force it down against my hand, and kind of milk it like that, up and down. So you're massaging the muscle in the meantime. And then you check to see if the arms are equal. Now in this case here we have a full resolution of that psoas problem. The arms are dead level. The next section of the spine, a very, very important section, is the middle thoracics, but more specifically the 12th rib. Now the 12th rib has been much neglected in chiropractic and osteopathy and in medicine generally. I've been working at this kind of therapy for 30 years now, and one of the things I wish I had known many years ago was how to examine for a 12th rib problem and how to fix it. Because since I learned how to do that, I am getting very good feedback from my patients, and I'm resolving cases that had baffled me in previous years. So the first thing you do to find out if there's a 12th rib problem is to use a few of our reflexes that we have in K-Practic. So to check the 12th rib, we ask Jim to extend his left arm up over his head towards the window. Okay, now I'm checking the leg length, and as I do, it's grossly pulling to the left hand side. We have a short left leg immediately when he does that. The reason for that is that when the arm is moved up like that, you are operating this part of the spine. So we go back to a neutral position there. Now, the 12th rib is in this area here. And many beginners complain that they're not sure if they have exactly the 12th rib. Don't worry about it. Just go along the spine here from the side and push, first of all, from left to right. Now, I can feel it there, but I'm experienced doing this. So it doesn't matter. If you're not sure, just go along the vertebrae there, push them to that side, and check again to see if the leg length is correct. And look at this. The leg length is now correct. So what have we learned? We have learned that a pressure from left to right here in the area of the 12th rib has a corrective effect. So what we need to do then is to apply that pressure from left to right. In order to get a good result, the person must be in motion. So we get the patient to move the shoulders up and down like that. Okay, and you just keep a steady pressure on the 12th rib. So you have moving ribs against your immovable fingers. Now, it can be a bit painful for the patient, and there are other more sophisticated ways of doing this. But in this first K-Practic 101, we're dealing with very simple, basic methods. That's sensitive there, is it? Okay. Okay. Now, we test again, and we're level. But we're not finished yet, because we have to make sure that we have performed the correction. So, stretch the left arm again up over your head. That's correct. And it's coming up level. So we did the correction and it succeeded. Now similarly, if you push from this side and the leg only gets shorter, it means that you need to be on the other side doing exactly the opposite. So you'd be pushing from the other side in that kind of case. It's either left-sided or right-sided. Statistically, you'll most often find that the person is out of alignment on the left-hand side, and it's usually a 12th rib on the left-hand side. But the next case you try will be the opposite, so that's the way it goes. Now, your nose is down dead straight. So what we have here is a short leg on the left hand side, pulling shorter when it's flexed. So there's a bit of trouble on the other side. So we go to L5 here. And then we check that leveled it very, very well. Now, even though it's level now, we still need to knock this sacroiliac into. Okay. Now, stretch that left hand up over your head, up towards the wall, straight. That's That's better. Now, yeah, straighten your arm now. Point it at the window. That's right. Okay, now that brings in the 12th rib. And as we do, the legs are gone totally short on the left-hand side. So we need to check which side you need the adjustment. So I'm going to press the 12th rib here from left to right. And if that's the way you need the adjustment, it'll level it, and so it does. So we're going to adjust that 12th rib for you. Now, it works better if your shoulders are moving. So move your shoulders, that's it. That's exactly it. Fantastic. Fantastic. Now take a deep breath in and all the way out. Okay, and a deep breath in again and all the way out. Okay, now relax there for a minute. So let's see what we have. We have the legs level. Now we have to check that we did our work properly. So stretch the arm up towards the window again, up over your head. That's correct. Now the last time it pulled you short, this time it's not pulling you short. So we have a correction.